Riverbend Awareness Project.
The views and opinions expressed in this podcast episode are solely those of the individuals participating and do not necessarily reflect the views or opinions of Riverbend Media Group or the Riverbend Awareness Project, its affiliates, or its employees. It is important to note that the discussion presented is for informational purposes only and should not be construed as medical advice. Listeners are encouraged to consult with qualified healthcare professionals for any medical concerns or decisions. The Riverbend Awareness Project is a product of Riverbend Media Group.
Welcome to the Riverbend Awareness Project. We are talking about National Migraine and Headache Awareness today, and we are excited to have Lindsey with us. Lindsey de Santos. She is the Program and Advocacy Manager for the American Migraine Foundation. Thanks so much for coming to be with us today, Lindsey.
Yeah, thanks for having me and your attention to migraine.
Yeah, no, I'm excited to talk about it because I personally haven't dealt with it all that much in my life, but there are some people who I care about in my life that, sorry, I got too far from the microphone. There are some people who I care about in my life that I've seen them deal with it. And so I think it's something that you don't always think about, but it's there. And some people, it's like there a lot in their lives. So I think it should be more talked about.
Yeah, I agree.
How did the American Migraine Foundation get started, and what are the goals of the foundation?
The Migraine Foundation? Sorry, you said migration.
Oh, yeah, Migraine Foundation. Monday.
Sorry, Jeff. I figured
No
it'd be
problem.
easier for you to edit if you...
I was just trying to make it all rhyme.
Sorry.
We got started. There's another organization called the American Headache Society, and they primarily were to give kind of more scientific information for clinicians. And so that's kind of the side that they focus on. And so the American Migraine Foundation was then born or created to provide information and support for patients, for people living with migraine. So we're really patient-facing. Our goal is to really help reduce the stigma around migraine and helping others feel supported. It can be a very lonely disease. And so we want to provide lots of resources. We have a support group. Our site has lots of resources. And then we also, when able, support research in migraine.
Very cool.
And how did you become involved?
Well, I have actually had migraine for over 30 years. I keep saying over 30 because it's true, even with how old I get. I'm not willing to say anything else. With that lived experience and seeing it affect not only my life, but my mother and my sister's life, it prompted me with just this passion to get involved. And so I started volunteering for actually several migraine organizations and then really needed to hone in on one. So that was where I put my focus on the American Migraine Foundation. And then prior to this position, I was a teacher for 24 years, which became even more challenging with migraine. But this position opened up and it was really the perfect time. I changed my volunteer role to a staff role and just feel like it's a great honor for me to be a part of this organization because I know how important it is.
How would you explain the difference between a migraine and just a regular headache to somebody who hasn't experienced a migraine?
For me, it is when we talk about a headache, the head pain is just so severe and debilitating. It's not something that you can take most of the time, and specifically for me, and over the counter, it's going to take some more intensive treatment. Also, some people with migraine don't actually get head pain, but they have other symptoms. And so other very common symptoms, which I've experienced in many patients that I talk to, also have sensitivity to light, sound, strong smells. It can affect your cognitive function. We can have a lot of brain fog and just kind of more difficulty putting your thoughts together. And so migraine just comes, with this whole list of other symptoms, which is why we're always saying it's more than a headache.
And you said when you were talking about the goals of the foundation, right? Reducing that stigma. What stigma is around migraine and that? Yeah, sorry. What stigma are there?
Oh, that's totally fine. I think the stigma, we call it an invisible disease because you really can't see what's going on. And a lot of times people with migraine try to mask that pain or whatever symptoms they're dealing with because they don't want to be a burden on someone. They don't want to have to step out of life, but it becomes so debilitating that, you really just don't have a choice. But because others can't see it, sometimes it's something that's dismissed, or people feel like, yeah, you're not really, it's just a headache, you don't, it's just a lack of awareness. So I think really helping others to be aware to how severe the disease can be and how much it can affect is really important.
Yeah, and just like you said too, like, it's not just a headache, right? Because you
Mhm.
mentioned those other things that can either come with the pain or can be there without the pain, and so I think that's, like, a very important, thing to know about it, so
Mhm.
What are some of the more misunderstood symptoms of a migraine?
Sometimes, and I didn't mention nausea, but you can also have that. And so I think sometimes that's kind of dismissed as to being something else. Sometimes patients are diagnosed with GI issues, or we've gone a different route. And then it's like, no, that's really just a symptom. It's not necessarily another issue outside of migraine. And so that can be something. The brain fog can be associated with other things as well, but with migraine it can be very prominent. So I think just really outlining all of your symptoms, and that's what can make migraine challenging to diagnose. That's why we really have to look at all the symptoms in your history.
makes sense. I think, um, so how does migraine impact someone's daily life?
Hmm. It can really, it can take over, and it can make you, even when you need to do things. I'm a parent, and I have a job, and I have a husband, and sometimes it affects where you're debilitated with this amount of pain and the other symptoms, to where you just have to remove yourself. And so sometimes you're missing out. It does affect people's work, it affects people's families. And even just where you're going, like, I love the sunlight, but there's some days where the light sensitivity is just so much that I'm having to shut all the blinds, and I can't even go outside with my kids and take them to the park because it's too painful.
Well, and you mentioned you were a teacher, I was like, that would be hard too,
Mhm.
because I just like being in a classroom, it can be overwhelming if you don't have migraine,
Yeah,
like
little kids are
Yeah.
loud.
yeah, loud and the smells and just all the things coming at you at once, so depending on, like, your job, that could
Mhm.
be really I mean, all jobs have elements of
Sure.
overwhelmingness, but still, and depending on, like, whether your job how much PTO time you have or
Mhm.
that kind of thing, that you can take days where you have, like, really bad migraine days, that would be hard.
Yeah,
Yeah, it is overwhelming. And that finally led me to retire just a bit early. But again, it was the right time. My life was new opportunities were coming, but at the same time, I kind of mourned the loss of that part of myself and missed my kids. They're always your students. But yeah, being in the room, I remember there was a day where I had asked a question, and all these different hands went up. And then I realized, and typically I don't have an aura, but some people do, with blurred vision or other issues. But in that moment, I realized I could not count how many hands were up. And so it was just terrifying, because, I am, like, that's your worst nightmare, is to be in a room with 25 kids and not be able to be that teacher. That's just, that can't happen.
yeah, I can't even imagine. Um, what other external conditions in different settings can negatively impact someone who's experiencing a migraine, and what can they do to lessen those conditions?
They're light with the light sensitivity. Fluorescent lights are horrible for people with migraine. And I know, particularly if I am light sensitive, or if I'm dealing with an attack, or it's kind of, I know it's coming on, that I want to avoid places like the grocery store, or, that just have these constant bright lights. And then
Yeah,
in some people's jobs, you don't always have the option to change the lighting. But I would encourage people, if you do, to reach out to your colleagues or your administration, whatever that might be for you, and have those conversations. And sometimes just giving yourself breaks can also help. So there are things to be done, but I think the thing that's the hardest is just really communicating what your needs are. And that kind of goes back to that stigma, you don't want to feel like you're putting anybody else out. But if we can do some things to change, then it allows people to continue on in the workforce. So that's an issue with migraine.
Learning to not be afraid to kinda advocate
Mhm.
for you, yeah, so that you can,
Absolutely. And
yeah.
that's another piece of AMF that's huge. I should have said that too. Is, well, that's part of reducing the stigma, but we were actually train people to be advocates and to advocate for themselves. So that's a huge piece of what we do also.
And what does that look like? I mean, obviously, kind of we had that situation, like, you kinda gave that example, right, of, like, your lights. If you have fluorescent lights in your office and they're bright and they're buzzing and you're having days that it's
Mhm.
impacting your health, what would that well, I guess what could that look like for advocating for yourself?
And I think now we know that you can also ask for accommodations. So I think if it is the lights, if there's a different location in your office, or if you can choose to use a lamp instead of the lights. I know everybody's set up differently. We don't always have these options, but it's worth the conversation. And then even noise can be really sensitive. So I've had people talk about the location of their cubicle, or whatever part they
Mm,
were working on, they were moved so that it would be quieter, and less difficult to maintain. Also, workplaces can be scent free. So that's something, if
mm,
you know, the administration or boss in your workplace could really support you in that. And then that also brings in the rest of your staff. But I think because migraine is a lot more prevalent than people realize, you would probably not only be helping yourself, but someone else as well.
mm, yeah. Well, and other people have other other coworkers might not be migraine, but maybe there's something else that maybe they have asthma or,
Mm-hmm.
something that could overstimulate their system could also overstimulate migraine. Sorry, I'm just thinking about all the different interconnected, like, somebody who might be more sensitive to loud noises or strong smells. Yeah, sorry, that
Yeah.
was not a question, that was just me thinking out loud.
No, no, you're spot on. So
Um,
yeah, 100%.
what are some of the barriers that kinda stop people from seeking maybe accommodation or just getting treatment of some kind?
Yeah, that's a great question. I think with the accommodation piece, we're worried that some people are worried they won't keep their job, or they'll be looked at as someone that's an added level of difficulty, instead of really preserving that person and recognizing them for the asset that they are. So that definitely can be difficult for people living with migraine. And then the diagnosis piece is really a conversation with you and your doctor. And I think a lot of times we're not getting to the right doctor. And, no offense to our different kinds of doctors, our primary care definitely are a lifeline for many parts of your health, but it's really not the best place to treat migraine. But sometimes it's back to that self advocacy piece, like, this just isn't working for me, and getting that referral to the neurologist, which eventually will hopefully lead you to the headache specialist. But I think that that's the challenge, is that you can be overlooked. And so you really have to advocate for yourself. And it can also be frustrating. I've lost count of how many medications I've tried and that have not worked for me. So that also kind of, when people keep hitting a dead end, then it discourages you, and there's the tendency to want to give up.
Yeah, that makes sense.
And what are some of the different treatment options for migraines?
We are in a time where it's better than it was when I first got diagnosed with migraine, but there are lots of different medication options. One now currently is the CRPG, which is given to patients. It can be an auto injector, it can be a nasal spray, it can be at an infusion center. So these, we want these to be one of the first choices for patients, because they're targeted to treat migraine. Doesn't work for everybody, but it is an option. And then there's lots of other medications that are a rescue medication to take when you get it, or get an attack. And then in addition to that, when you become chronic, like I have, then you start looking at a preventative medication. And so there's lots of options for those too. Some that are made specifically for migraine, others that were not made for migraine at all, but off label. They could potentially reduce the frequency and severity of your attacks. In addition to medicine, some people find acupuncture is helpful, physical therapy, And then we also have new sorry, I can't talk. Neuromodulation devices that are also alternative treatments. And so one of those goes on your forehead and it kind of tries to reach that trigeminal nerve that is potentially causing your attack. There's another one I have that I can wear on my arm, and that one's better for me because I can go about my day. If my
Mm.
kids need something, I'm not laying down with this thing stuck on my head. But if you're in the middle of a pretty bad attack, then you're going to do it anyway. So I do feel like we have a wider range of treatments for patients, both medication and then also alternative, which I think is helpful.
It seems like just from the tiny little bit of research we did when we were trying to, come up with educated questions,
Mm,
um, that there's lots of different factors when it comes to what can cause a migraine, and we
mm,
don't necessarily know all the causes of a migraine, but, like, there's things that can trigger it or,
mhm.
those kind of things, so I feel like having different options is helpful because it seems like and I might be wrong, right? Because 'cause I'm not a doctor, um, or a medical professional or anything like that, but that there are different, um that's not the right thing to say, not different migraines necessarily, but, like, different reasons people might have a migraine. So, having different treatments is awesome.
Yeah, and we have different, there's different types of migraine. People respond differently to different treatments. So I think, there definitely is never a one size fits all. I've also found for myself and for lots of patients that sometimes it's a layering of treatments. You may need multiple medications, or may need medication and this alternative medication or alternative treatment to work together. So again, that takes, some not giving up, some perseverance and some courage, because it's hard and it's frustrating and it's scary when you're not able to control this disease.
Yeah,
Um, are there sorry, this one's not on our list, Jeff. I'm just gonna go
that's okay.
off the list. Are there any, like, up and coming treatments or medications or anything that are kind of like we still don't know for sure, right, if they're, um,
Mhm.
gonna work, but is there anything kind of in the migraine world that you're kind of excited about research-wise, I guess?
I one thing I've learned, and I appreciate this about the American Migraine Foundation, is just learning that there's always hope. And it feels like there's always something around the corner. So when you feel like you've tried it all, there is more to come, and that's something that I try to remind people, like there's always hope. I know that we are continuing to work on medications that come in different forms. So, or I say I'm not a medical professional either. I'm a patient advocate and I have lived a lot of lived experience. But also, this is a part of the training that we do to help people become advocates. So, sometimes I know we've got nasal sprays coming out, we've got different kinds of treatments that can act faster. I know for me, it became where if it was a pill and I just had to wait for it, it just wasn't effective. So I needed something to get it into my system quicker than that. And so those, I feel like working to think, looking at the formulas, can we put this in a different type of form, or no format's not the word, form, I guess, so that
Mhm.
you can help the patient quicker. But again, there's always something on the horizon.
I guess most medical fields are that way. There's always new things coming out.
Yeah.
Mhm,
But it's good to keep in mind, I feel like, right? Because, like you said, Lindsay, like, it can be frustrating if you've tried a bunch of different things and you're like, "I've tried all the things and they're not working," and then be like, "Oh, wait,
mhm,
there's a new thing." Like,
Yeah,
I wonder,
mhm,
like, before the nasal spray, right, there was obviously a time before that, so that became
mhm,
a thing that helped, deliver treatment into the system faster, and, who knows what will be next kinda thing, so
mhm.
I think that's a
mhm,
good mindset to have.
Absolutely. And I do currently have it's like it's kind of like an EpiPen, and it has a medication that I can get when I am, or when I don't want to be at the hospital, but when I am at the hospital, I've been admitted many times for migraine, but this is a medication that they give me when I was in the hospital. And continue if I'm admitted. So just to be able to take that at home and not have to wait in the ER, because then it's almost like you're waiting to get worse. But when
Mm.
I'm at that point, um, I have no choice when I haven't been able to manage it at home. So, but yeah, it is encouraging that I feel like we're always, like you said, working on things in the medical world. So that's good for people to remember.
yeah. How can we better recognize migraines as a serious and debilitating medical condition?
I think it's more just about continuing to be aware. And, I had a girl, I lived with her in college, and my migraine attacks have progressively gotten worse over the years, but we've been friends for a really long time. And up until the last few years, she said, I just never realized how bad it was. And so, I mean, she's one of my closest, nearest, and dearest friends. And I thought, I haven't done a good job because if you don't know, then nobody knows. So, just being able, I think, to spread that awareness is huge. And it can be scary, but it is so needed.
Um, Sorry, I'm jumping off pace again. You mentioned kind of more of your journey, right? If you don't mind sharing, when did you like get diagnosed with migraine and when did it kind of start? And if you want to share, if you don't want to share, that's okay too. But
Oh, no, I've shared a lot, so and lots of different capacities, so it's okay. I think that's why this work is so important to me. I actually think that I had migraine when I was 15. I remember missing school, missing swim meets. My mom had migraine and asked the doctor at that time. She said, "This looks a lot like what I deal with." And they said, "No, no, it's not migraine. We don't think that she has that." And so 15 years later, after progressively, continuing to get worse and continuing to try to be persistent, I was 30 years old when I finally got the diagnosis for migraine. And so just to realize that I had been untreated for that long and what role that could play in the progression of this disease is also it's very unfortunate. And so we hope for others that it doesn't look like that. And that's why I think that we keep saying that word, but it's so important that advocating for yourself. So, not until I got to a headache specialist did I get a true diagnosis of migraine.
uh, sorry it took so long. Oh,
Yeah.
but good for you for keeping trying to get help. That's yeah.
That is a long time to go
Yeah.
with something untreated like that. Um,
Mhm.
for people who've never experienced migraine, what's important to understand about someone who's going through it?
Mm. Honestly, I think just asking that person or first just affirming that you understand they're going through that and making them feel heard. And then it can be, what can I do for you? And maybe, I mean, my family has learned to dim the lights or to get the ice pack out for me. Or, I have two young boys, they go play in the basement, just so in the conversation. So I think really and we don't know what we don't know all the time. So I think speaking to someone in your life and saying, I don't really know anything about this, but what can I do to help you through it would mean the world.
Awesome. Um, I guess we kind of already talked about that, but are there other kind of more general practical things that people can do to help a friend or family or even a coworker who has migraine and is going through a migraine?
Yeah, I think, well, if they're within the migraine attack, you might ask if you can help with whatever they're working on. Or when I was teaching, I had our PE teacher, she kept her fridge stocked with Coke or Diet Coke. And sometimes for me, caffeine with something else will kind of actually help. For some people, it's a trigger, so it doesn't work for them. But she would look at me and say, I think you need a Coke. And so just realizing that, like, she didn't understand everything that was happening, but she cared about me. And so she was able, to do that. And part of that's just forming those relationships with your coworkers, but we can be quieter for people. We can, perfume's not really necessary. We can do things to help make it easier. And I think honestly, just listening is sometimes the best thing.
Um, what helps or gives you hope about migraine and the future of what
Mhm.
mm, it could bring? Like
I
medic.
think oh, sorry, go ahead.
Oh no, you're good.
I think part of the hope there is that, kind of like we talked about there, continually coming out with new medications. So I feel like I have tried so many. So to know that we're not giving up, and also to finding that headache specialist, that I realized she's not going to give up on me either. I've had three other neurologists that said I was too severe to treat. And so that is just devastating as a patient. But once I found this doctor, she said, did it help you to come here the first time? And I said, you gave me hope. Like I was losing hope. And I think also we are spreading an awareness. People are starting to learn more. And so I see that with my work with the American Migraine Foundation. I have patients that are reaching out. I think people are starting to find that they're not alone. And so I think that gives me hope because migraine can be very isolating. And there have been times in my life where I truly have felt isolated just to trying to survive.
What has, I guess, helped when you felt that isolation? What has helped you feel part of a community again or
Mm.
not as alone?
I think I just really had to draw on my people. And it reminded me that I'm going to have to be honest and I'm also going to have to do the reaching out. And so, I may not be the person that can maintain lots of social events. And let's be serious, I have two children, anyways. That's a challenge. But I think for me, just realizing I can't do it all, but who are the people that I feel like are really going to be an encouragement in my life and really just invest, even if it's a smaller number, and try to find times where I can get out and can meet with people, and that has been important. I'm also really close to my family, so I think just recognizing whoever it is in your life, you need a support system, and it's just even though it's isolating, it really is not something to live through alone.
Yeah.
Thank you.
Yeah.
Is there anything else that we didn't talk about that you wanted to touch on that you felt was important that we missed?
I think you guys asked some great questions. I would think I would share if anyone is looking for, we talked about that support system. If you don't have someone in your life yet that you feel like you can talk to, or even if you just want to feel heard by other people that have migraine, the American Migraine Foundation has a Facebook support group. We
Mhm.
have about 37,000 people in that group.
Oh,
And
wow.
so it really, yeah. So we realize we think we're moving in the right direction because it continues to grow and people can hopefully feel heard. You can ask questions. You can even just say like, I'm having a bad day and I need support. And you're going to realize there's people rallying behind you. So that's really important. We're also revamping our, I hope it's okay for me to say these things.
It is.
Not trying to be promoting, but I'm working on revamping our emerging advocates program. And so within that program, we will also train people that sign up to be patient advocates. And whether that looks like you really advocating for yourself, which is great, you may choose to go on and advocate for others, which is also great.
It's awesome.
Yeah, well, that's good. Those are ways that people can have a community and a support group and
Yeah.
Mhm.
learn more about it too. Because I feel like it's scarier when you have something and you don't know. So, like, if you have a question, I know sometimes I feel dumb when I'm asking a question. Like, I bet people know that, but like, people are like, I don't know. Like, knowing helps me understand something better and be
Yeah.
less frightened of it. I feel like if someone's just going through the beginning of a diagnosis or just starting, like that would be
Mhm.
helpful to be able to reach out and be like, "Does anyone else deal with this? Like, what
Yeah.
do I do?" So I think that's
Mhm. Absolutely. And we get those questions all the time. So I think anybody stumbling upon that would just feel very supported. So it's a pleasure for me to see others join in and supporting each other. It just makes me feel like our work is worth it. And as much as we push forward, we're going to be able to help people.
Hmm.
sure.
Well, awesome.
Yeah,
Thank you for talking with us today. It was I learned a lot,
yeah.
and like I get migraines occasionally, like maybe once a year. I'll
Mm,
have a day where it's like, yep, I'm shutting the lights off, leave me alone.
Mhm,
I know my mom gets them a little more regularly than that. She always has since I was a kid. When I was young, I
mm,
didn't really get it. It was like, why is she just laying in a room? Like, take some ibuprofen
mm,
and get back to
mhm,
it. And then once I had probably my first one, it was like, oh, I get it. Just shut the lights off. We need to
mhm.
go outside. It's a quiet day.
yeah,
Yeah. Yeah.
for
That's
sure.
exactly right. That's how it is around my house too. I pray my children don't get it, but I'm always aware if one of them says their head hurts, I'm like, oh no. I'm like, does the light bother your eyes? Is it too loud for looking like any of those other symptoms? So hopefully they don't develop migraine.
Thank you so much, Lindsay, for taking the time to talk with us today and for sharing your experiences and inviting others to share theirs. I appreciate too. I know that there was a time difference, so I'm like, oh, hopefully we're not keeping her um too
Oh
crazy of a
gosh,
schedule. But
totally fine.
no, we
It's my
appreciate it.
pleasure.
Yeah, thank you so much. We'll try and I might email you and ask for like a link maybe to the Facebook or your the other page, and then we can put that in the notes at the bottom of the episode so people can check that out if they
Okay.
would like. So yeah,
Yeah, that'd be great. I'd be happy to send that to you.
Awesome.
awesome. Thanks so much.
Yeah, thank you.
Well, thank
Well,
you guys very much for your attention to migraine. So this is good work that you're doing.
well, we try. We learn lots on this podcast, and it's funny too because like every time the new topic, I'm like, oh, this is a new thing, and it's I love
Mm,
how much we learn and how much passion people have for a lot of these things that are really hard and how much hope there is because
mm.
of people supporting one another and looking beyond themselves to like help others. So I think it's really cool.
Yeah, yeah, I agree. That's great. I'll have to check out the rest of your podcast too. So
Oh, thank you. Yeah.
you're so welcome. I'm glad you reached out.
Yeah. We'll do our little exit and outro and then yeah, we'll be good. So
Yeah.
yeah, go ahead, sorry.
Um, thanks for listening to this episode of the Riverbend Awareness Project. You can find it in all of our other episodes wherever you get your podcasts.